Kalanhi is a deprived farming community in Wa East in the Upper West region of Ghana. The people of Kalanhi are still struggling to get access to potable drinking water, health facility, electricity, and a good motorable road. For 48 years today, the community with population of over 922 never had a health facility. They move for about 8 kilometers to Logo for healthcare delivery. Sometimes women lose their babies, others give birth on the way. This community does not only lack a health facility, but the road they ply to the nearest hospital is very bad. Upper West PRTV cited about 5 uncompleted bridges from Kalanhi to Logo, and this is a worry to the chief, Na Santin Salifu.
Kalanhi swara titare kombo kara. Kuna yunda a problem. Ka asor mingane banna wadiago nti asor pile kufo regime. Baka banamala asor akuti. Karja ingama to kufo regime ni banwa pili tinya galma banle ojo. Tilo banaka atamis regime banla wa. To banla wana asaka salfu unala DC. To bandi grader atura asora wayi. Timbanka ngayen te pen yamba. So to abanaga kodorko hepile na te aka ngayen te mentor ko yare jana. To no ya abanaka foi apana wana to kodorko ni bantor mea aba fela. Hali darugba bayan ala paga kodorko he. Ala yi abla purin ka kombor andama ebonga ya manchenti do akombor lang mayang apaha. So to kunung akuro DCE akuro nimbi ma jorba. To chat nambanya besian sombo na lampiaga. So ajuni pampana tinjinga cha anwulo Kalanhi ka poga na dogo se logo. Ka bie jumbiara se logo. Ka yala jana wa balance side la se logo. Cha kombo pom minjang. Na bandie danse ya poga anda andora ka kwa mempa. Ade adan ye nimbijia. Ti dan die moto be mambankanin salbe mambandie moto. Ti dan ye bi pola bani. Kabana acha tinda moto tuo alwanen alowada pomin tuo blanitin tuoguni alwanen cheri juba no puo tinda nda po du tetanen dogata yirenin wa abie puo cha apoyan unanyunyi voruhum cha bawara iheni ka abie pie ala to iha bie cha apoyan nyunyi voruhum ajun atwara lampia kamanda nyu adiu.
According to the chief, waiting for government to address their challenges is over because several appeals made to past and current government has not yielded any results. The community members have started contributing monies to put up a temporary health facility.
Awatinjinyalanga tumoya mbla wa bala awonu government ba tonati yala karme minga turu du ihi mambo ma yiri minting tinkpe minting. So tinya ka blase karmi I pampana ke nan jing ne ja kumba yala tinga to Paul law in charge to danga to page bala irnes unde ni ti yeten to Paul law in charge so ka law in charge no unventim bon deba minting ka yiri jayi ade adam nga wanya yiri ni ma hapwe so umen turnya no baji umen moyo more to u hiyen amen joga pa director mga anya videos anen jaman an bia yirin chan wuloti jaman janji ni nurse bunyen jaga bia yirin a ewonsiale ajun director mi yenim bijia kanan da wo ka yuena ban ventim ban ka yuena ka government bati ha doctor bonga clinic he so kana badana ka badana force ko me clinic kuti ka chat tuara an tabla wala tinna tin ya ka yalmala titereji NGO ka me school kuti ya a teacher quarters ya 8 rooms. So tint so her. A teacher hamemba jenebe. So tint so have 4 rooms. Kabadi bekuti. Karidi belly a cheap compound. So ka bonus akuti. So ka tinjim blana ndanda list wakue. So tendeku anese bamina se obonet nanya before. Chabanya a cheap compound. Abaga to phone chat phone kwanto maja. Timin ya photocopy. Adika ku DC adika ku MP chairman tarakanga ntia daratin da paminti nti yiringa jan karan to pwe sama kuta dawtere 15 city daw jambi a yiring in the man e. Capo jamming terry, 10 city in the man e. So Carmen more a bonnet to what one dad. Bonnemen MPB DC and Wanya Sontene. Ka bason te Carbania clinic a year, can I anti banjing. Jetin na more talabla, so tinder e, chia bonnet in the chain, to the nearly Burbiala. Tebanya Jachet and by nearly Burger 50 million.
Women of the Kalanhi community also share their grievances with Upper West PRTV.
Doy la jaye yo setaron la ya. Ajira ja. Awasen ya setar doye unwe la tare doye. Doye la tene sa du sana. Sinyara wo papa. Ajina as a doctor sepa na se babo. Mama ton bo a doctor doye jun gba sonya ju mama ton bo nso gbo po ma bia bo chin tan sopo. Ko do asopo ason ba yijum ugotuwa na wuchena. Ko yem na ko do asopo. Doye la yo ja si dire wona wa se diana. Si dinen doye pa. Kasinya kai isa anton la anuma sen papa.
Oh, akasi ten la sini dire doye lo ya. Nye sono pa inter po na wa do. Po gba inter. Doctor sa matun chene aka yire do. En po de tele bia doctor pa doctor de mina. Ta ya ma for to le. Se kunye moto na be chine. Ado ba jami yina. Ba mi che mo po. Ma sen ye na so chen. Ka i bon aso te viele. Se na ma nye so ka ko tala me bi moto ko tala ka fa so ko bofo. Te fon kunyai adom bebe ngam fon ye na fo yi po do a ofo ka fi yi na fo na gbe na fi chin doctor fo ko metu chene ka anya jaya ka se pan pie dira do ya se me gbo me buso na ngma ka na wo so ka se nya na ngmndere kutun ipepo kama ne watun tuon cho asiji na ko se
aka sitara tuol lo pa sitara wona fon tara po so na entara po wata dofo ka ba chi bobo ya wan ka wo bo ma chin doctor ba bo ma ta kula paka kuma se baka tun chi ma doctor poi kala lewa wado we na cha ba ichi ma ba anta taraka kuma se akula po saka tun gona se yimune ya na si chene wesiya na ale yo ntun ipo ma biemba dunkuru te tonya te tara doctor yi kula na amatuwar ta ya sota don na tun nya bobo ya ko yimune ya ko de abie na wuchi na doctor po ma so te san fa te wo yimune ya te wa bebe te se na mu yesele te pa mba ka twol nya sin dire e bibli gba balko ma ton ta te woto so ka fo bora fo na tun chin kan yen gba na fara san ba na fa yimune ya na fo ko abibidun tije bobo ya e bia moto fo ka nyam moto na fo chine fo mo ko moto ya to so be na fo yimune ya na fo defo gbe anya tan lo na fo nya ba san fie ndre bia moto atana ai doctor pale ba to mba wotin kon ka ba na wusu ka awa yale
After 2
hours of struggling on the bad road from Kalanhi, Upper West PRTV, next stop was the Logo Health Center. The Logo Sub-District in charge, Mr. Agbeni Ezekiel, said it is necessary for the Kalanhi community to get a health facility due to the distance and the population of the community.
Kalanhi is one of our hard-to-reach communities within the sub-district. Most especially the rainy season, we find it so difficult to reach the people, and the people also find it difficult to also reach us. It is full of, the road is so bad and full of rivers and so many other challenges in, trying to get to the people. Yes, of course, it is necessary. They are equally Ghanaians like those of us from elsewhere, and so for health facility, it is so important they get. In fact, they should even be the first. If I were the person if I were in power, I would have considered those faraway communities first, because most of the times it is so difficult, like I said, to reach the health facilities when they have emergencies. They don't have means of transport, they don't have anything at all to do, and they don't have the facilities around and the personnel to help them. So they deserve it. Almost every day we receive clients from Kalanhi, because I think it's also a big community with a lot of people in that community. We receive pregnant women, women in labor as well. We receive children that are sick with diverse kinds of diseases. So for the clients, they do come, I can say, every day. What we plan doing as a sub-district and as a district at large was to get them a mobile clinic. We started the process of establishing a mobile clinic there, but we could not continue because we didn't have so many facilities. I mean, so many things. For instance, we needed at least a motorbike for the staff that would go there. We need also an accommodation for that particular staff, and so many other health items that would help to establish just a simple mobile facility for the people of Kalanhi. So my appeal to our authorities is that if they could help the people to also get a health facility by building one for them, one cheap compound for them, and also providing, things like means of transport, I mean motorbike for instance, and other health equipment that would help to cater for the people there. In fact, if we even get 2 or 3 staff there, I think it will be very, very important. We're not just thinking about a community health nurse. If we also get a midwife there, it will be very, very, very important, because most of the times, like I said, a lot of the pregnant women there come for, services.
As you can see, this is uncompleted bridge behind me. There are 5 of them on this road. And if water will fill here, meaning the community members cannot cross it for medical care. Reporting for Upper West PRTV, my name is Idris Sudasana, Kalanhi, Upper West Region, Ghana.